Today on Substance Stories, we're going to be talking about types of therapies and how to find the right therapist. Today on Substance Stories, I'm joined by a colleague of mine at the Victoria Clinic. Welcome, Annie. Sorry, should start off with welcoming you, Annie. We want to talk about today how to select a psychotherapist and what you should be looking for, and probably try and answer any questions that might pop up. So, Annie, my first question is, what is a psychotherapist?
Yeah, so a psychotherapist, essentially, you could say they're a fancy way of saying a talk therapist. So a psychologist, a psychiatrist, or any type of, counselor. So you can have specific types of counselors that are sort of specific to what your needs are. But generally speaking, psychotherapist is someone who provides talk therapy.
A wonderful answer. You're a psychotherapist, Annie.
Yeah,
I'm a
I am. Yes.
psychotherapist.
Yes.
And I think people can get very locked into, oh, well, this psychotherapist has this qualifications, this psychotherapist has this qualifications. I think the answer with regards to that is what's on paper often doesn't really translate into skills. So I sort of think, do you like the person? Are they coming highly recommended? Do they sound like they know what they're talking about? Is usually a handier way to go when choosing. And if I'm looking for psychotherapy, I'm looking for talk therapy. How do I go about this? Like, what should I be looking for?
Yeah, absolutely. I mean, you nailed it, really. There are certain things that you want to have in a therapist, a good therapist. So they would obviously provide you with empathy and active listening. And those are kind of key factors of a talk therapist. Um, but other things you want to look for is, of course, shared goals between you and the therapist, and somebody who you feel that you can trust with, your deep, dark secrets or things that you don't feel comfortable talking about with other people. So there is a term for those things. I don't know if you want to get into that just yet, Rich,
Yeah,
but I know,
yeah, go for it.
yeah.
Go for it, Annie. Go for it.
Um, there's a thing called the common factors model. So, generally speaking, those common factors, the empathy, the shared understanding, the likability of your therapist are things that are essentially more relatable to a positive outcome than the type of therapy that is provided. Yeah.
Absolutely. Common factors theory used to be called the dodo race conundrum or something like that, which is fantastic. It's a pity that we got rid of the fun phrase there, but it's more important that you like your therapist, that they're an expert in their field, and that you guys have a shared goal towards where you're going than the actual therapy itself. I always add in a specific one when we're talking about addiction, and that is that you are willing and able to talk to your therapist about your addiction. Because if you're seeing a therapist and you have an addiction and you don't feel like you can bring that into the room, and that's not unheard of. I talk to a lot of people that have long relationships with their therapist, but feel they can't discuss their addictions, this thing they sort of compartmentalize off to the side. I'm not sure
Yeah.
that's useful to you. So I say the common factors plus addiction.
Yeah.
But Annie, you said, sorry, mate. Go.
No, I was just going to say, yes, absolutely. There are, these common factors, the overarching idea that there are things that are more important in some instances than the techniques used by the therapist. But in saying that, when things like addiction and trauma history come into choosing a therapist, you do want somebody who has knowledge and training in those areas. You can't just kind of pick any person you can, I don't know, talk to. Yes, it might be nice, but they perhaps won't have, the skills or the training to be able to deal with the things that you want to talk about. So it is still important, especially when we get into more nuanced areas of counselling. Yeah.
Absolutely. And I think you were just anticipating what I was going to talk about. There are so many different sorts of therapies, and we've already had podcasts on ACT and schema, and I'm sort of hoping eventually we'll do podcasts on all the different therapies. That there are different therapies sort of implies that there is use for different therapies. But you've just told me, Annie, it doesn't matter as long as I like my therapist. How do you meld those two ideas together?
Yeah. Yeah. I mean, I suppose the question you asked before was, how do you find a good therapist? And honestly, it's a very, very good question, because you could, um, be referred to somebody by a friend, you could be referred to somebody by your doctor, but in reality, you might need to go through a few therapists before you find the right one. If you're referred to somebody who, has everything on paper, they've got their training in trauma, they've got their training in addiction, they've got, this and this and this, and that looks great. So if they've got all of that and then you go and see them and it's not a good fit, then try somebody else. But again, I know that kind of sounds, like a lot of work to find the right fit. So I think the main message is not to give up too easily, because it does have a big impact in your recovery or in your positive outcomes of therapy. If you have a good relationship or therapeutic alliance, essentially, then your outcomes are more likely to be a success or a positive. So
Absolutely.
it will
Absolutely.
take a little bit
That
of work.
relationship is key,
Yeah.
isn't it? And I think what you were saying, Annie, is you've got to sort of try towards you buy. Before you buy, what I tell people is, some people we just don't get on with. So if you meet with me and you're a normal person, you'll say that guy's a prick and try to avoid me for the rest of your life, and that's fine, right? We go through life meeting some people we like, some people we don't like. The tricky thing with therapy is that we can, if we start talking to someone and doing some therapy that, it's going to make us uncomfortable if we are doing useful therapy. And so 10 or so sessions in, we might find ourselves thinking, oh, this person's actually a prick and I misjudged the situation. And I would say 9 times out of 10, that is projection. That is avoidance of the relationship. We need to push through that. And I talk to so many people that have said, I've seen 8 different therapists, each for about 2 to 3 months, and none of it's helped. And I say, well, you haven't seen any therapists. This is a disaster. Um,
Yeah.
but at the same way, I also talk to people that have been seeing the same person for years, and from the day dot, they didn't like this person, but they felt, I have to push through this. And that's, so if you like someone after 2 sessions, book for 50. If you don't like them after 2 sessions, never see them again. And I think, as you're saying, it can be so hard to find a good therapist, and it can be helpful in this circumstance to have sort of a trusted expert like yourself, Annie, like myself, that says, I know this person, I know that person. Why don't you try them out? We'll catch up in a few weeks and we'll see how that goes. Have you helped anyone do that? And what sort of pitfalls have you run into when trying to help someone find help?
Yeah. Well, I look, full disclosure, I'm still completing my Masters of Counselling, so there's sort of a lot of networking happening. But I do know a lot of people who have finished their studies and have started sort of making those connections, and yeah, in some cases they do have really honest feedback from their clients, essentially, who say, look, I don't feel like this is working right now. And they don't take offense. A good therapist should not take offense when their client says, look, I don't think this is working, or I don't feel comfortable opening up, and that's fine. You should be able to I guess I wouldn't want to say a bad therapist, but you probably don't want to trust in somebody who, is going to feel butthurt about, being left because it's not working. Like, you've
Yeah,
got to be honest and open, and just understand that, yeah, no, I'm a therapist and I might not like my client and they might not like me. So it's okay to pass on somebody to somebody else, or go find another therapist, because you can see that the relationship isn't going to facilitate a positive outcome. So yeah, and I've heard
absolutely.
it, go both ways, honestly. So
Oh, absolutely. I think generally, if there's a breakdown in the relationship, there's a breakdown in the relationship. I think you both feel it,
yeah,
probably.
yeah,
The other thing that I think I always advise people, if you're worried, bring this into the relationship. Say it in the room. I'm worried, because often the therapist, as you say, is also feeling that. So that could lead to you growing together, or you both agreeing this isn't for me. And I
yeah,
think another thing, that you touched on before is that we need to have a shared goal. And it
Uh-huh.
amazes me how often I talk to people and I say, well, what are you doing with your therapist? What is your goal? And they've never had that conversation. Oh, what sort of therapy do you do with your therapist? And they've never had
Mm.
that conversation. I think it's a perfectly legitimate question to say to your therapist. First time I met my therapist, I said to her, what are your qualifications? Which I think she was slightly taken aback by, but I think it's super relevant. I'm going to spend, the next now 8 years of my life talking to you about very intimate things. I think I
Mm.
deserve to know, whether you have a degree or whether you're trained in a certain thing.
Yeah.
And then checking in throughout the relationship, saying, what are we doing? What's the goal? Because therapy is not for life. Good therapy ends. And so we should be, if we're having these doubts about our relationship with our therapist, we should be able to bring that into the room. And if we can't bring that into the room, we should be thinking about why, or if we bring it up with our therapist and our concerns get dismissed, I think that's a big warning sign, and I think we should be able to say, I think my concerns are being dismissed. Why is that? As you say, Annie, a good therapist is not brittle. And
Yeah,
I think that it merits having a discussion.
that's right. And it's that honesty and openness that you're obviously talking about. If you don't feel comfortable saying to your therapist, I don't feel like this is working, or even I feel uncomfortable right now, I don't feel like we're gelling today, I'm getting an uncomfortable feeling. If you can't say that to your therapist, you know, you're going to have problems, right? You're not going to be able to be fully open
Mm,
with it. And you just need to, I think, from the get-go, ask them questions, be direct, and hope that, they are direct with you as well. There's something that a good counselor or therapist in general, I think, should be doing from the get-go, and that is case formulation or case conceptualization. And
mm,
that essentially will be looking at the type of therapy that I'm going to use, or the skills and the techniques that I'm going to use, what that looks like with you. So, the first session or two sessions, you're getting a history, you're getting an understanding of who that person is, where they've come from, what their factors, predisposing,
mm.
precipitating, etc. The 5 Ps, and that is kind of this model where you're working out, how am I going to help this person? What kind of therapies and skills and techniques am I going to use with them? And if that counselor or therapist can't share that with you, if you can't talk openly about, these are the goals that I'm thinking about for you, um, you know, you you just want that. You want that in your therapist. You want to be able to have that conversation and
Absolutely.
rely on the fact that they have a plan for you, and these are the
Yeah.
reasons why I think this fits for you. Um,
Yeah.
yeah,
Well, I think if they can't share it, either they don't have a plan and that's a worry, or they do have a plan, but it's quite mean towards you, or they feel unable to share it towards you for some reason,
yeah,
which again, that's
yeah,
a worry. So,
yeah,
I think we need to have shared plans. So we talked
absolutely.
briefly about how to find a therapist, Annie. I want to
Mm.
just generally talk about different types of therapy. So people talk about sort of manualized versus unmanualized therapy. What does that mean? Can you explain that to the punters?
Yeah, yeah. So, I mean, something like manualized therapy, I guess the easiest one to discuss would probably be cognitive behavioral therapy. So, it's essentially the term meaning that it's really structured. It's quite sort of ABC. You know what to do, you know what you're delivering. Um, I guess you can open a book and go, "Okay, this is how it's done." And so it's really easy to roll out. And
Mm.
it's really easy to test in clinical trials. So I guess, there's a reason why there's so much empirical research on CBT, because it's easy to do in trials. And non-manualized, um, you know, would be who are we talking about? Freud? Psychodynamic
Yeah.
therapists. So that's, really getting nitty-gritty into the background, the childhood, the history of a person, and what makes them who they are today. And that's really, really difficult to kind of put into clinical trials because it's so individualized. So I guess that's the
Mm.
main difference there, is that there are some who are very sort of dot point, 1, 2, 3, step by step, you know what you're doing. And then there are others where it's very sort of dependent on that person's story, their history, where they're coming from, that kind of thing. Yeah.
And in Annie, the other thing you hear talked about a lot is sort of top down versus bottom up, or sometimes
Mm.
people say upstream versus downstream.
Yes.
What does that mean? Was that you that said that, Annie? Did I steal that from you?
Or upstream or downstream.
Yeah, I think.
No, I don't know if that one was me, but
I don't think
yeah,
so.
top down is like assessing or addressing the, um, I suppose you could say, the symptoms of a problem that you might be having. So you could be addressing things like anxiety and the thoughts that you're having around that. And so CBT does a bit of that, they're addressing the
Mm,
thoughts that you might be having, and the behaviors that come from that. And it might be addressing things like anxiety and depression, the symptoms that you're experiencing, and how do we deal with that.
mm,
Um, and whereas the bottom up uh, type therapies would be dealing with, the core historical traumas, or things that have
mm,
really um, changed your core beliefs. Like, it's getting really into the belief system and the
mm.
history of where things have come from, what the problem has been caused by, in a way. Yeah.
Yeah.
Um,
The
and
way I often
yeah.
think about it is top down helps me manage how I'm feeling, and bottom up helps me not feel that way or work out why I feel that way. And I think a good therapist and a good most modern therapy sort of integrate both. So things like ACT or MBT or schema sort of try to be both, but even though they're very manualized. It used to be that non-manualized therapies were the sort of bottom up and manualized therapies were the sort of top down. But now I think, you talk to most sort of psychodynamic psychiatrists or psychotherapists, and they would say they integrate a lot of sort of top downy window of tolerance, regulation technique stuff, as well as the sort of sit on the couch, tell me about your mother, Freudian stuff. And then you talk to a lot of sort of CBT therapists, or MBT or schema, and it's very like, where are these thoughts coming from? How are we addressing that? How do we address how we're seeing the world? Do you yourself, Annie, have a personal favorite therapy with your masters in counselling?
Um, to be honest, I feel like I'm still finding my niche of what I like to deliver, and it really does depend, I think, personally, on the type of client that you're
Mm.
seeing. Um, I have I have recently learned a lot more about acceptance commitment therapy and really like it. Um, you know, but there are other therapies that I think are probably my kind of core deliveries in terms of um looking at people's core beliefs and how they've kind of developed and those kinds of things. So I'm probably, at my core a bit psychodynamic, in terms of what I look at and how I want to treat somebody's, yeah, problems, I
I think
guess.
a beautiful response by a great therapist, an
Mm.
individualized response, stealing from a bit of this, stealing from a bit of that.
Yeah, I tend to
Fantastic.
do. Yes, borrow from everywhere, which, you know what, I think a good therapist does that anyway. You find
Absolutely.
the best parts of each therapeutic style or technique, and as long as you know how to deliver them and you're delivering them well, and not just taking aspects, but delivering the full effect. You can use all kinds of different therapies. You don't have to be stuck in one little pigeonhole.
Absolutely.
Yeah.
Absolutely. So fantastic. So I think in summary, the most important thing is that your therapist is no fool, that they're trained, and that you get on, uh,
Mm.
try before you buy, and then commit. If you have any questions, talk to an expert, talk to Annie, talk to me. Let's help you
Yeah.
find someone you trust, and then commit. Thank you so much for joining us. Thank you so much, Annie, for your first substance stories. It was fantastic to
Yeah.
have you on.
Thank you. Thanks for having me.